Hello, my name is Sarah Russell and I'm a clinical exercise specialist and the founder of Me Plus Recovery. I'm from the UK and I'm the global exercise consultant for Convatec. I specialise in working with people who have had stoma surgery, and I am passionate about exercise and the role of rehabilitation in helping people live healthy, normal lives. Me Plus Recovery is a rehabilitation programme for anyone who has had stoma surgery. It's a simple 3-step programme designed to help people regain core strength and general fitness. It's appropriate for everyone regardless of their age, physical ability or the type of surgery they've had. It's even for those people who have a hernia. Nurses and doctors can work with patients to help them select the exercises that are most appropriate for them, and patients can use it on their own to work through the exercises at home. The programme can be started as soon as 3 or 4 days after surgery if the patient is well enough, but people can do it at any time. It's never too late to get started. The exercises are all very gentle and designed to strengthen but not strain the body, and they are ideal for the older patient. I first got the idea for the Me Plus Recovery programme after I went through stoma surgery myself in 2010. Having always worked in fitness and rehabilitation, I knew I needed to strengthen my abdominal muscles, but no one could really tell me how to do it, and there weren't any guidelines to follow. I had 5 operations, so I had plenty of time to practice, and during this time I developed a series of exercises which I knew felt safe and appropriate, and they helped me recover faster and get back to the things I loved. I've since gone on to run 34 marathons, and I'm passionate about doing Pilates, strength training and being as fit and healthy as you can be when you have a stoma. And being strong with good muscles will also help us to reduce our risk of parastomal hernia. Being physically active is so incredibly important for all of us, no matter our age. It helps to reduce our risk of so many chronic diseases, including diabetes and cancer, and it helps keep us healthy and boosts our mental well-being. It's essential for life and health. And having a stoma shouldn't prevent people from doing exercise in any way. We just need to teach our patients how to exercise safely and appropriately. When I started working with other people who had had stoma surgery, they said they had similar experiences. They knew they needed to do something for their abdominal muscles after surgery. They felt weak and vulnerable, but they just didn't know what to do, and they were worried about getting a hernia. Their nurses and doctors didn't know how to advise them or what the best exercises were, so the result was that no one really did anything. Convatec surveyed people with a stoma and found that 80% of people were never given advice about exercise by their nurse or doctor. So in 2016, Convatec launched Me Plus Recovery in the UK to try and solve this problem and provide people with better care. I remember when we first launched it at a national nursing conference in 2016. We had hundreds of nurses rush to the stand to get information because they wanted to hear more. They wanted to know how to teach safe exercises to their patients. Their patients had been asking for years, but the nurses didn't know how to help them. Since then, thousands of people in the UK have done the Me Plus Recovery programme. We've also trained over 350 nurses and healthcare professionals in the UK. Other countries have adopted the programme, and it's been well received in Poland, Italy, Germany, Denmark, the USA and Canada. Me Plus Recovery has a number of professional accreditations, including the Royal College of Nursing, Association of Coloproctology Great Britain and the Association of Stoma Care Nurses. In the UK, the Association of Stoma Care Nurses established guidelines stating patients should start to do core exercises 3 to 4 days post-surgery. And this excellent guideline is what Me Plus Recovery is based upon. Our vision is that core exercise and rehabilitation becomes standard care for everyone having stoma surgery. And this is starting to happen in some centres. In the UK, we have a number of hospitals who've been very successful establishing the programme in their practice. St James's Hospital in Leeds, known as Jimmy's, is Europe's biggest teaching hospital. They now introduce Me Plus Recovery to all their stoma patients. They teach patients the exercises as part of their surgery school, which people attend before surgery as part of their pre-admission pathway. This means the patients know how to do the exercises and can do them as soon as they feel ready after their operation. This also cuts down on nurse workload as patients are more empowered and educated. So although these exercises might seem really small and simple, they're incredibly effective and they form the foundation of recovery for everyone. Patients talk about how much more confident they feel, how they can get in and out of bed more easily, they can start to mobilise earlier because they feel stronger and they have a sense of control through their centre. People recover faster, they return to activities of daily living sooner, and they have more confidence to get back to work and to do exercise further down the road. Most people say how doing the programme gives them a sense of doing something positive for their own health, and it helps them feel happier and more able to cope. And we also know that being physically active could reduce the likelihood of developing a peristomal hernia. The Me Plus Recovery Programme is a menu of 24 exercises developed in 3 phases. They include exercises that can be done lying down, sitting in a chair or standing up. Nurses and patients only need to select a few exercises in the position that feels most appropriate for them. It's best to focus on just 1 or 2 exercises to start with. So let me tell you just how easy these exercises are. The first thing we should teach all patients is diaphragmatic breathing or rib breathing. This is an intentional breathing exercise where we encourage the diaphragm to work correctly with the other core muscles. The diaphragm has a really important role in core rehabilitation. So let's imagine the ribs are an umbrella. As we breathe in, we feel the ribs open outwards. As we breathe out, we can encourage the ribs to close and pull downwards, which helps the respiratory and core muscles work correctly. Repeat this a number of times. People can practice this intentional breathing a few times a day, very soon after surgery, and then start to incorporate it into other exercises, such as the pelvic tilt. This is an exercise which can be done lying in bed, but can easily be done on the floor as well. This is the first exercise in the Me Plus Recovery Programme in the green phase. It encourages the deep core muscles and pelvic floor to work together, especially if it's done with intentional breathing, and it also helps to mobilise the lower back. This again can be done a number of times each day to start with as the patient starts to recover.
Let's start with a simple exercise called pelvic tilting. So place your hands on your lower abdominal area. Put your fingers into a V shape, into a diamond shape, so your thumbs are together and your fingers are together. Place your hands on your lower tummy, so your thumbs are in your belly button and your fingers are pointing down towards your pubic bone. And we're just going to start by rolling. Imagine you've got a marble. So the marble is in the diamond, and we're going to roll the marble towards the thumbs and then away down towards the fingers. And roll the marble up towards the thumbs and down to the fingers. So you can just see I'm creating a tilting motion with my pelvis. So nothing else is really moving, just that pelvis. And what this is doing, it's reconnecting with these deep abdominals. We're drawing in with the transverse abdominis and the pelvic floor. And we're just connecting and tilting with that pelvis. So you would do maybe 10 to 15 repetitions, creating a little bit more awareness and connection with those deep abdominal muscles as you tilt back.
These are both exercises that patients can access immediately post-surgery and in line with nursing guidelines. They are safe and gentle and will help to build confidence and restore function to the core muscles. From there, patients can add more exercise and build up what they're doing depending on how they're feeling. I'm so excited for you to learn about Me Plus Recovery. and I hope you're looking forward to sharing it with your patients. At Convatec, we believe that Me Plus Recovery should be part of standard care for every stoma patient and be part of the recovery process for everyone. Good luck in the future as you start to change your practice and help patients feel more confident and to become more physically active. Thank you for being part of Me Plus Recovery.